You should be within one plan for maybe 3 years, so there's an investment in helping you be healthier.
Picture this. You turn 65, you're excited to finally be on Medicare, the healthcare freedom that you've earned after decades of working and paying into the system. But instead of choosing your own Medicare plan, you're automatically enrolled in the cheapest possible Medicare Advantage plan in your area with a network, and you're locked in there for 3 years. No switching allowed, no escape clause, and no freedom. And this isn't some weird dystopian fiction. This is actually proposed now, a bill in Congress, House Resolution 3467, that would fundamentally transform Medicare from a program built on choice into one where the government picks your insurance company and locks the door behind you. For almost 60 years, Medicare has operated with a simple principle. When you turn 65, you decide how your health care works. Some people choose original Medicare with a Medicare supplement to plug all the holes that Medicare has, and they pick a drug plan that fits their prescriptions exactly. Others choose a Medicare Advantage plan because they like the low premiums and they don't mind staying in network and the other restrictions. The key has always been you decide, not Congress, not an insurance company, you. This bill would change that. According to the proposed legislation, beginning in 2028, that's when the changes would take effect, every person turning 65 would automatically be enrolled in the lowest cost Medicare Advantage plan in their area. You don't choose it. Your doctors weren't considered. Your prescription drugs weren't checked. The government just picks based on price and assigns you to it. And here's the kicker. Once you're in, you can't switch for 3 years. Now, to be fair, supporters of this bill argue that it's about reducing Medicare fraud, waste, and abuse. Those problems are real. Medicare's own Inspector General reports that improper payments to Medicare Advantage exceeded $23 billion in 2023 alone. But here's where their logic falls apart. Instead of fixing the fraud, they're forcing seniors into the very system that's accused of fraud. Let me explain why this matters so much. Medicare Advantage and Medicare Supplement plans operate in completely different worlds. With original Medicare, plus a Medicare Supplement like Plan F, Plan G, and Plan N, you have the gold standard of freedom. With those plans, you can go to any doctor, any hospital, or any specialty provider in the entire country as long as they accept original Medicare. That's over 90% of nationwide providers, according to the Kaiser Family Foundation. No networks, no restrictions, no referrals required, and no prior authorization games. If you live in Florida and you want to see a specialist at the Mayo Clinic in Minnesota, you can. If you're traveling out west and you need to go to a hospital in Arizona, you can. If your health changes and you need the very best cancer center in the country, you're already covered if you have original Medicare and a Medicare Supplement. You don't have to beg for a referral or wait for prior authorization to be stamped approved by somebody. You just go. That's the promise of Medicare with a supplement. Medicare Supplement plans are also predictable. With Plan F, Plan G, and Plan N, you know what your out-of-pocket costs are going to be. You don't have to worry about surprises or high co-payments or denials or small, narrow networks. That's why 13 million seniors, and we have 20,000 of them in our agency, have chosen Medicare Supplement because they offer security, nationwide freedom, and choice. Now, Medicare Advantage works differently. It's run by private insurance companies that use networks. They require referrals to go see specialists. They require prior authorization for anything that's going to be what they consider to be a major procedure. A 2022 report from the HHS Office of Inspector General, we covered it extensively on this channel. They found that Medicare Advantage organizations deny care 13% of the time with prior authorization requests.
Medicare Advantage is the managed care option within the Medicare program. It's designed to provide efficient, high-quality care that improves patient health outcomes in a cost-efficient way. But a new report by the Department of Health and Human Services, Office of Inspector General, found that sometimes Medicare Advantage plans limited access to medically necessary services. To explain this report's findings, here is Rosemary Bartholomew.
In this report, we found that Medicare Advantage plans sometimes denied or delayed patients' access to care, even though the requests for services were medically necessary and met Medicare coverage rules. So in other words, the patients likely would have received approval if they had been enrolled in traditional Medicare rather than in Medicare Advantage.
These report findings are cause for concern for several reasons.
We have three main concerns about these denials for care that was medically necessary and that met Medicare coverage rules. First, these denials can cause delays or prevent patients from accessing needed health care. And that can be particularly harmful for patients who are critically ill and for whom any delay in care can cause negative health consequences. Second, these denials can cause some patients to pay out of pocket for services that are supposed to be covered by their Medicare benefits. And this can be particularly harmful for low-income patients and those who can't afford to pay for these services out of pocket. And third, these denials can cause an administrative burden for patients and providers who choose to appeal these denials. And even when denials are overturned upon appeal, we found that in some cases, going through the appeals process caused significant delays in patients' access to needed health care.
For more information, visit oig.hhs.gov/Medicare Advantage.
That's millions of medically necessary services that have been delayed or denied completely every year. So when this bill here talks about automatically enrolling everybody into a Medicare Advantage plan, what it's really saying is forget about freedom, forget about universal access, forget about being in control of your care. You're getting a plan with restrictions, with networks, with prior authorizations, and you're stuck there for 3 years, whether you like it or not. Let me pause for just a second. Longevity risk is the biggest retirement risk that there is. That's outliving your savings. And studies show that retirees that have a guaranteed income, a private pension plan, if you will, are 40% more likely to say that they're happy with their retirement choices. We can help you build those steady paychecks for your essentials and income that can rise with inflation so that you can enjoy the retirement with confidence. If you've saved for retirement and you want that kind of peace and security, book a time with us now, and we'll help you walk through what your options are. All right, back to today's Medicare news.
But the fact of the matter, MedPAC and the Wall Street Journal series and the ProPublica series have gone over Medicare Advantage. And if any of you have your phone and you like tracking, stories, put in Medicare Advantage fraud right now. You'll see at least 5 major articles from the Wall Street Journal, ProPublica, and some of the others. In some of those articles, if you actually add up, it's $100+ billion a year in fraud. So we've introduced a piece of legislation. The preliminary number is around $1.7 trillion to $1.840 trillion. Trillion dollars. Sorry, what am I saying? $1.840 trillion, making it the single biggest reduction bill, I believe, in modern history. Actually, in history at all.
This congressman is right about one thing. There is significant fraud in Medicare Advantage. Insurers have been caught upcoding diagnosis to get more money, making seniors look sicker than they really are, just to get those bigger payments from the government. But look, the solution that he's proposing, instead of strengthening oversight and fixing the payment formulas, they want to lock seniors into the same plan for 3 years. But when you lock seniors into one plan for 3 years, you're not creating an incentive for better care. You're creating a captive market. If their health changes, if the doctor leaves the network, if their drug coverage just doesn't work for them because it's included in a Medicare Advantage plan, they're just stuck. If you're locked in for 3 years, the plan will supposedly invest more in your health. But basic economics tells us the exact opposite happens when companies have guaranteed customers. Competition drives quality. When customers can leave, companies have to earn their business every day. When customers are locked in by law, the incentive disappears. Let me give you a concrete example of how this could affect real people. Imagine you're turning 65 in the year 2028. when these rules would kick in. You're planning a big traveling trip. You're going to go out west somewhere, maybe to see the grandkids in another state. With original Medicare and a supplement, you're covered anywhere you go. Under this new law, you'd be forced into an Advantage plan tied to your local network back home. Needing care outside the network, you could face thousands in unexpected costs. Or consider medications. Maybe you take 2 or 3 common generic drugs. Under today's system, you could use a basic Part D plan under $10 a month. Under this law, you'd get whatever drug coverage is assigned to that Advantage plan, whether it covers you or not. And what happens if you're 1 year into your lock-in period and now you're diagnosed with something serious, cancer, Parkinson's, ALS, and the plan that you were auto-enrolled in, the cheapest plan in your neighborhood, doesn't have the right specialists or won't approve cutting-edge treatments that you need? According to patient advocacy groups, prior authorization delays average 16 days for serious conditions right now. Now, will this pass in its current form? The political reality is kind of complicated. Seniors vote at higher rates than any other age group. We know that. And they don't like being told what to do with their health care. But don't underestimate the insurance companies' lobby. Medicare Advantage is incredibly profitable. Companies like United Healthcare, Humana, and Aetna reported combined Medicare Advantage revenues exceeding $400 billion just a couple of years ago. They spend millions of dollars on lobbying to protect and expand their market share. So even if this exact bill fails, elements of it, like the 3-year lock-in period or automatic enrollment, could resurface in future bills. This is how Washington works. So controversial positions get repackaged and inserted into bills that they have to pass, like the big spending bill. When public attention is elsewhere, these things get slipped in. And here's what matters most. Medicare has always been about freedom of choice, the freedom to pick from original Medicare or Medicare Advantage plan. The freedom to choose, if you want a Medicare Advantage plan, you get to pick one that matches up best with your doctors or your drugs. This bill would end that freedom. Whatever its intentions, reducing fraud, saving money, improving care, the mechanism it uses strips seniors of their fundamental right to choose their own health care. Seniors deserve real reform that addresses fraud, yes, but without punishing the very beneficiaries themselves. They deserve transparency about what the costs are and the coverages, and they deserve to keep the choices they were promised when they paid into Medicare their entire working lives. So here's what you can do. Contact your representatives now. Share this information with anyone approaching Medicare age and make it clear Medicare choice is not negotiable. The stakes here are too high to remain silent. I'll keep you updated. Make sure you stay subscribed to this channel and share this video before this kind of stupidity gets out of control. God bless you. Thank you for watching. Bye-bye.